Welcome to the Deep Dive. Today we're plunging into something really quite fascinating and ambitious coming out of India. It's the school health program.
Right, and it's part of the bigger Ayushman Bharat effort.
Exactly, and it's a really compelling look, isn't it, at how a country is trying to use its existing infrastructure,
These schools.
specifically its huge school system, as a primary way to boost the health and well-being of its kids and teenagers.
Mhm. We've been looking through the operational guidelines for this program. It's quite the document.
It really is. And it's a massive joint effort, you see, between India's Ministry of Health and Family Welfare and the Ministry of Human Resource Development.
So our mission for this deep dive is to really get under the skin of the strategy here. How exactly does India plan to use schools to reach literally millions of young people?
And make a real difference to their health, hopefully.
Yeah, and when you dive into the sources, the why just jumps out at you. Good health, it's not just, personal. It's presented as totally foundational.
Foundational for education, foundational for national development. It ties directly into meeting those sustainable development goals for 2030.
Absolutely. And with India's massive youth population, investing in child health isn't just like a nice idea. It's critical. You could say it's vital for the country's future.
Okay, so let's unpack that core thinking, the why behind it all. The guidelines really hammer home this point. Schools are just this unique, almost perfect platform.
A platform to reach kids and adolescents consistently, right? With health education, promoting healthy habits, even delivering some services directly.
Exactly. Why school? Well, think about it. Kids spend so much time there.
Yeah, hours every day.
They're interacting constantly, not just with friends, but with really important role models, teachers, the head teacher.
And the timing is crucial too. Childhood, adolescence. That's when behaviors really get set, isn't it?
Habits formed then, good or bad, often stick around for life. So stepping in right there, in that environment, at that age.
It offers huge potential for effective, long-lasting impact.
And the scale is just mind-boggling. The program aims to reach around 26 crore children.
That's, what, 260 million students? Ages 6 to 18?
Yes. And think about the ripple effect. It goes beyond the kids themselves, potentially influencing families, communities, as these messages filter home from school.
The sources even point out that, historically, school health programs tend to show a really good cost-benefit ratio. It's an efficient investment.
Which loops back to that national development point.
Yeah.
The guidelines really stress this link between health and learning. It's undeniable.
Healthier kids just do better in school, right? Better attendance, better focus.
Leads to better scholastic achievements.
Yeah.
And then better education is linked to better health later on. It's this positive cycle.
A prerequisite for a thriving nation, as they put it.
But okay, to understand what the program actually does, we need to look at the problems it's trying to tackle. The sources are quite specific about the health challenges young people face there.
And it's a pretty wide range of issues.
They mention things like widespread nutritional issues. Anemia rates are cited quite clearly. Substance abuse challenges. Growing worries about mental health.
Yeah, they even mention prevalence rates for mental health concerns. And then there's violence, injuries.
Critical reproductive health problems, too. Things like early marriage, teen pregnancies, STIs, and the need for better menstrual hygiene practices.
They even get into newer things like cyberbullying, digital challenges.
But the key point they make is that a lot of this stuff isn't inevitable. It's preventable.
Preventable through informed choices. And that's where the education piece comes in.
So this huge school program, it's not just floating out there on its own. The guidelines position it very clearly. It's an integral part of that much larger Ayushman Bharat program.
Right, specifically under its health and wellness component.
Its role is really to beef up the preventative and promotive side of health, specifically in schools.
And it builds on existing programs, doesn't it? Like RBSK and RKSK.
Exactly.
Yeah.
Rashtriya Bal Swasthya Karyakram and Rashtriya Kishore Swasthya Karyakram. It's about making sure these efforts all pull together, creating synergy. Convergence, they call it.
Okay, now this is where we get to the kind of the nuts and bolts of how it works. The core innovation seems to be designating teachers.
Yes. 2 teachers in every single school across the country. They're called health and wellness ambassadors.
2 teachers per school. That's a huge number nationwide.
It really is. It places incredible reliance and trust on the teaching force. Their job is basically to be the local health champions right there in the school.
Preferably one male, one female teacher, the guidelines say.
Yeah. And they're responsible for leading weekly sessions, focused on health promotion, disease prevention.
And not just lectures, right? It's meant to be interactive.
Yes, interactive activities for about an hour each week. They even propose every Tuesday as the official health and wellness day in schools.
Interesting. And what kind of teachers are they looking for?
They want proactive people, self-motivated, good communicators, teachers who can really connect with the students.
Makes sense.
There's a preference for science or PE backgrounds, maybe younger teachers, under 45 ideally, who bring that energy.
And the guidelines even mention maybe special recognition for these ambassadors.
They do. It highlights how important their role is seen to be. They're not just teaching kids, they're ambassadors to the students.
And the students then become messengers in society, spreading the word.
That's the idea. Influencing health practices back home, in the wider community, is quite a vision.
But, okay, training potentially millions of teachers across India, that sounds like a monumental challenge. How do they actually plan to build that capacity?
Good question. The guidelines lay out a specific training model. It's a cascade approach.
A cascade model, how does that work?
Okay, picture this. It starts at the top. National level master trainers get trained.
Right.
These masters then train state-level trainers, about 4 per state.
Okay, state level then.
Those state trainers train district-level trainers, usually 3 per district.
Got it. District level trained.
Block-level trainers, 3 per block.
And then finally,
It's those block-level trainers who do the hands-on training for the 2 ambassadors from every school within their block.
wow, so the training cascades down through multiple layers. That's some serious logistics.
It really is. It shows a huge commitment to trying to standardize the delivery across the whole country.
And how long is this training?
Most sessions are planned for 5 days, with about 30 teachers per batch, keeping groups manageable.
Okay.
There's also a shorter 2-day orientation just for school principals, run by the block trainers.
Mm-hmm.
Got to get the leadership on board.
Makes sense. And they use existing teacher training facilities.
Yeah, they mentioned leveraging existing capacity like the District Institutes of Education and Training, diets.
And the training content itself, what are they learning?
It's based on those existing adolescent health programs, RKSK mainly. Covers the key themes we talked about: nutrition, mental health, preventing injuries, violence, substance misuse, sexual and reproductive health, preventing NCDs.
So equipping them for those weekly interactive sessions.
Exactly. Giving them the knowledge and the tools.
So, okay, the ambassadors are trained. What actually happens in the school then? What do these activities and services look like day to day, week to week?
Right. The guidelines detail a pretty structured set of activities. There's a definite rhythm.
Big weekly things?
Yeah. Weekly, you've got those classroom sessions led by the ambassadors, and also the giving out of iron folic acid, or IFA, tablets.
Okay, weekly IFA. What else?
Then maybe fortnightly or monthly, they suggest thematic school assemblies on health topics and dealing with questions from a question box.
Ah, the question box. That's a smart idea.
Isn't it? Lets kids ask things anonymously. Helps break down embarrassment around sensitive topics.
Yeah, definitely. And the ambassadors use those questions to guide discussions.
That's the plan. Quarterly, they envision dedicated adolescent health days, and also using existing parent-teacher meetings to talk health with parents.
Engaging the parents too? Good.
And twice a year, lining up with National Deworming Day, students get albendazole tablets.
Okay. Now, are the ambassadors doing all this alone? Sounds like a lot.
No, there's a support system built in. They're backed up by health and wellness messengers. That's 2 students picked from each class to be peer advocates.
Ah, involving students directly.
Yes. And also other peer educators, like the Sathiyas, who already work on adolescent health, plus local health staff like A&Ms and block adolescent health coordinators.
So a network.
Right. And they get resources too: activity kits, AV materials, films, posters, apps, helplines, lots of support materials mentioned.
And a key role is linking kids to actual health services if needed.
Absolutely critical. Ambassadors help connect students who need more than just education, maybe screening, counseling, treatment to local health facilities.
Like adolescent-friendly health centers or the regular health and wellness clinics.
Exactly. They act as that bridge from the school environment over to the formal health system.
Okay, let's dig a bit deeper into that package of services students are meant to receive. You mentioned health promotion, screening, and actual services.
Yeah. So health promotion is that core educational piece, tailored for different age groups, obviously.
Right. What does that look like?
For the younger primary kids, it's basics hygiene, common illnesses like malaria, dengue, TB, worms, how vaccines work.
Makes sense. And older kids. Middle school.
Topics get broader: puberty, taking care of eyes and teeth, nutrition, bullying, internet safety, substance awareness, basic mental health, even yoga and meditation.
Quite comprehensive. And high school.
It deepens further, more on substance abuse prevention, sexual and reproductive health, violence prevention, road safety, nutrition again, still promoting mental and physical fitness like yoga.
Okay, so that's the education part. What about health screening?
Right, this is a specific activity. It's done by those RBSK mobile health teams. They visit schools.
Mobile teams coming to the schools.
Yes. And they screen students for a defined list of 30 health conditions.
30 specific conditions, like what?
Well, the list covers a range. Things detectable at birth, like cleft lip, congenital cataract, deficiencies like severe anemia, vitamin A or D deficiency, common diseases like ear infections, dental cavities, and developmental delays or disabilities, vision, hearing problems, autism, learning disorders. It's quite broad.
Aiming to catch things early.
Exactly. Proactive identification.
And if they find something.
That's the crucial link. Any child flagged during screening gets referred for free treatment and intervention at public health facilities.
Detection and access to care. That's key.
Absolutely. Then there's the direct provision of services within the school setting.
Like the iron folic acid tablets you mentioned.
Yep. Weekly iron folic acid supplementation, WIFS. Specific doses for different age groups. And critically, these are administered weekly by the teachers.
By the teachers themselves. Wow.
Yes. Same with deworming the albendazole tablets, given twice a year on National Deworming Day. Again, administered by teachers, following the guidelines.
That shows a significant level of trust and responsibility placed on the teachers for basic health tasks.
It really does. The guidelines also mention menstrual hygiene management MHS, saying sanitary napkins may be provided in schools alongside the education piece.
Okay, important aspect.
Plus, regular age-appropriate vaccination, coordinated with local health staff visiting the school, and the program explicitly promotes physical and mental fitness.
Through things like yoga and meditation led by the ambassadors.
Right. And interestingly, there are even provisions mentioned for research to actually study the program's impact over time.
Good to build an evaluation. What about records? How do they track all this?
Yes. A key component is the plan to develop electronic health records, EHRs, for every student.
An EHR for every school kid.
That's the ambition. A student health card logging screening results, services received, integrating school health activity info, digitalizing RBSK records. It's a big data goal.
Makes sense for tracking and continuity.
And one more piece, emergency care skills, training teachers, even students, in basic first aid.
Essential life skills.
Making sure first aid boxes are there, making everyone aware of emergency numbers, ambulance, fire, police, linking with local disaster response teams too. Preparedness.
Okay, so that's a huge amount of activity, structure, and ambition. How on earth do they manage and monitor this beast across the entire country?
Yeah, the implementation and monitoring structure is key. It's built on coordination committees.
At different levels.
Exactly. National, state, district, and block levels. And the constant theme, as we said, is the joint approach.
Health and education ministries working together.
Primarily, but also pulling in others. Women and child development, Panchayati Raj, drinking water and sanitation, recognizing health isn't just a health ministry issue.
Right, that convergence idea again, different government arms working together.
Precisely. The flow is pretty logical. National level sets policy, guidelines, resource plans. Then it cascades down through state, district, to block level for implementation, training, and local coordination.
And the committees at each level monitor progress, sort out problems, make sure everyone's collaborating.
That's the idea. While the school management provides the space and time, the ambassadors deliver the activities, the kids participate.
And how is it actually monitored? Supervision.
Dedicated teams from all levels, central ministries, state, district, block, do periodic visits. They use standardized formats.
Checking on progress. And they track specific indicators, KPIs.
Yes, key performance indicators tracked annually. And it's a really broad list, which tells you a lot about the program's scope.
Like what kind of things? Not just disease rates, I assume.
No, much broader. Things like access to safe water and functional toilets in the school, basic but vital. Hand washing facilities.
Hygiene infrastructure.
Exactly. Also, uptake of menstrual hygiene counseling. Coverage rates for the IFA and albendazole distribution, ensuring kids get their midday meals.
Nutrition link.
Checking if schools adhere to tobacco control laws. Tracking mental health sessions, referrals made, how many people got first aid training.
Wow.
Education sessions on violence, gender issues, even participation in physical activity sessions. The sheer range shows how holistic they're trying to be.
but also highlights the challenge of tracking all that data effectively.
For sure. And the reporting process reflects that complexity. Data flows upwards.
From the classroom.
Starts there. Ambassadors record class data monthly. Principal or ambassadors compile a school report monthly, sends it to the Block Resource Center.
Okay, school to block.
BRC compiles reports from all its schools, shares with the Block Medical Officer monthly. The Block Adolescent Health Coordinators help manage this, often using an electronic system, an EMIS,
And block data goes up.
to the District Nodal Officers. They compile it for the State Nodal Officer and the District Education Officer,
State level compiles it all.
and sends it up to the Central Ministry of Health and Family Welfare. They plan to use and enhance existing education data systems like Shalakash UDIs for this massive information flow.
It's a huge data network mirroring that training cascade we talked about earlier.
It really is. So as we sort of wrap up this deep dive, it's crystal clear that India's school health program under Ayushman Bharat is, well, it's way more than just checkups.
Oh, absolutely. It's this ambitious, multi-layered strategy trying to weave health education, prevention, and healthy habits right into the fabric of daily school life for millions.
And that emphasis on joint ownership between health and education, plus pulling in other sectors, that feels like a real potential strength, doesn't it?
Definitely. Recognizing that health and education are just so intertwined, you can't really separate them if you're aiming for development.
The vision is undeniably transformative, taking these detailed guidelines, these ambitious goals, and turning them into sustained action across such a vast country.
If they can pull it off, it could genuinely improve the lives and the futures of, well, generations of kids and their families.
And maybe a final thought connects back to that idea of the students themselves becoming health and wellness messengers.
Right. If we take that seriously, the idea that behaviors and knowledge picked up in these school years really can stick for life, it makes you wonder, doesn't it?
How might this whole initiative, this huge push, fundamentally shift the future health landscape of a nation with such an enormous young population?
Yeah, that potential ripple effect.
Yeah.
It's certainly something powerful for you, the listener, to think about.